Brachytherapy. A comprehensive overview. Brachytherapy is a specialized form of radiation therapy used in the treatment of various cancers. Unlike external beam radiation, where radiation is delivered from outside the body, brachytherapy involves the placement of radioactive sources directly inside or near the tumor site, thereby minimizing the radiation exposure to surrounding healthy tissues. This precision makes it a valuable treatment option for specific cancers, offering both therapeutic efficacy and reduced side effects. This video provides an in-depth explanation of brachytherapy, its applications, and its advantages compared to other treatment modalities. Understanding brachytherapy. It is a localized and targeted form of radiation therapy that capitalizes on the proximity of radioactive sources to the tumor. Interstitial brachytherapy. In this method, tiny radioactive sources, often referred to as seeds, are placed directly within or adjacent to the tumor. These sources emit radiation, targeting the cancer cells precisely. Interstitial brachytherapy is used in various cancers, including prostate, breast, and head and neck cancers. Intracavitary brachytherapy. This approach involves positioning radioactive sources within body cavities close to the tumor site. For example, in cervical cancer, a radioactive source is placed in the cervix. In gynecological cancers, such as uterine and vaginal cancers, intracavitary brachytherapy is a valuable treatment modality. Surface brachytherapy is employed for superficial cancers like skin cancer. Instead of inserting sources into the body, a specialized applicator with radioactive material is positioned directly onto the skin surface, ensuring that radiation is precisely delivered to the cancerous area. The advantages of brachytherapy. Precise radiation delivery. Brachytherapy's hallmark precision allows for the delivery of high doses of radiation directly to the tumor, thus minimizing exposure to nearby healthy tissues. This minimizes the risk of collateral damage and associated side effects. Higher dose delivery. Brachytherapy can administer higher radiation doses than external beam radiation therapy. This is particularly advantageous when a concentrated radiation dose is required to eradicate cancer cells effectively. Shorter treatment duration. Treatment courses in brachytherapy are often shorter compared to external beam radiation therapy. Some cancers can be effectively treated in just a few sessions, enhancing patient convenience. Reduced radiation exposure. Since the radiation source is localized, there is less radiation exposure to the skin and surrounding tissues. Consequently, the risk of radiation-induced skin damage and long-term complications is diminished. Preservation of normal organs. Brachytherapy is adept at preserving the function of critical organs or structures situated close to the tumor. This is of particular importance in cancers where the tumor is adjacent to vital anatomical features. Applications of brachytherapy. Prostate cancer. Brachytherapy, specifically permanent seed implantation, is frequently used to treat early-stage prostate cancer. Radioactive seeds, typically containing iodine or palladium, are implanted directly into the prostate gland, delivering a high dose of radiation to the tumor while minimizing radiation to adjacent tissues. Cervical cancer. Intracavitary brachytherapy is a cornerstone in the treatment of cervical cancer. A specialized applicator is placed in the cervix to deliver radiation directly to the tumor site. Breast cancer. Brachytherapy can be employed as a boost therapy following lumpectomy, breast-conserving surgery, in breast cancer cases. By targeting any residual cancer cells in the surgical bed, it helps improve local control. Gynecological cancers. Brachytherapy is frequently used in uterine, vaginal, and vulvar cancers, often in conjunction with external beam radiation therapy or surgery. Skin cancer. Surface brachytherapy is an effective treatment modality for non-melanoma skin cancers, primarily basal cell carcinoma and squamous cell carcinoma. It allows precise delivery of radiation to the skin cancer lesions. Comparison to other treatments. External beam radiation therapy (EBRT). Brachytherapy differs from EBRT in its method of radiation delivery. While EBRT delivers radiation externally, targeting the tumor from outside the body, brachytherapy relies on the internal placement of radioactive sources. This results in a more localized and concentrated radiation dose. The choice between brachytherapy and EBRT depends on various factors, like the type and stage of cancer, tumor location, and individual patient considerations. Surgery – brachytherapy can serve as an alternative to surgery in select cases. When surgical removal of the tumor is technically challenging or poses significant risks, brachytherapy provides a non-invasive option for tumor control. In conclusion, brachytherapy is a specialized form of radiation therapy that offers a range of advantages, including precise radiation delivery, high dose capability, shorter treatment duration, reduced radiation exposure to healthy tissues, as well as the preservation of nearby critical structures. Its diverse applications across various cancers make it a valuable treatment option. It often used in conjunction with other therapies for optimal patient outcomes. The choice of treatment modality, whether brachytherapy or an alternative, largely depends on a comprehensive evaluation of the patient's medical condition and the expertise of the healthcare team. It is, however, a valuable alternative treatment. Thanks for watching. Ellen and Michael Moriarty, 2 RNs.